Welcome to Healthcare Forward, where industry leaders, benefit advisors, and healthcare professionals come together and discuss the changing landscape of commercial health plans. Brought to you by Roundstone Insurance, the first group captive for health insurance, where smarter self-funding meets long-term savings. I'm Mike Schroeder, founder and president of Roundstone Insurance. Hello, this is Roundstone's podcast, Healthcare Forward, and I'm Mike Schroeder, your host. Today we're going to be talking with a nurse who has years and years of clinical experience in operating rooms, both here in the United States and overseas. Welcome, Lisa.
Thank you for having me today.
Lisa Grobmyer has worked for Roundstone. How long have you been with us now?
Just a little over a year now.
A little over a year. But you've been a nurse a little longer than that, am I right?
I have. I've been in the OR for 30 years, doing a lot of clinical experience.
And both here in the United States, and you've spent some time overseas. Is that fair?
Absolutely. I worked in the ORs while I was in the military overseas in Japan. And also I do mission trips. I try to do one a year.
Great. So you review complex claims here at Roundstone.
Absolutely.
I think you shared with me the title is Medical Nurse Claim Reviewer. Is that right?
Yeah, Medical Nurse Review.
Medical Nurse Review. Okay. So what does your experience compare like or bring to the table with what you're doing today at Roundstone?
So a typical day at Roundstone, we review the high dollar claims that come in to make sure they're correct, they're paid correct. We also review members' prognosis for the underwriters. So we take the medical claims, look at what is going on, and try to project a cost for the underwriters.
Now that's a little different than when you go on your mission trips, right?
Absolutely.
What's the name of the mission trip?
I go through Operation Rainbow.
Operation Rainbow. And so what is that like?
It's wonderful. It's an organization that we go to third world countries and do pediatric ortho surgeries. Mm-hmm. It's honestly organized chaos. You do the same thing. We bring all of the medical equipment from the U.S. So you get, for your personal use, you get one little carry-on for the entire week. For the medical supplies, we take 30 to 50 bags, about 75 pounds a piece of all the sterile supplies or what we'll sterilize down there to use. I always tell the doctors that MD no longer stands for medical doctor. It's make do. So they have to pick up a mop and mop the floor to help us out in between cases. Wow. But we try to make the surgeries to U.S. standards.
Great. So that's a very different experience than here in the office in Roundstone.
Yes.
Last time I checked, I haven't seen too many of us mopping floors. No. But, I mean, both experiences remind you why you became a nurse. Can you share a little bit about what that is?
Absolutely. It's to make healthcare better. To be honest with you, in the OR, you get the immediate result. You start a case, you end a case, and you fixed a bone, and it's an immediate result. It's better. Here, it's same thing. You still get that personal satisfaction, know that you're saving costs and making healthcare better on that end. We are cost containing, so the groups can have provide medical insurance for their employees at a reasonable cost.
Great. Let's talk a little bit about claim review. Okay. How do you know a claim is okay or correct, and then how do you know when there's maybe something that just doesn't look right?
So as part of the nursing job, we take the claims, they come in numbers, they're codes, and every code is, attached to a diagnosis. So we kind of decode everything and translate everything. And then we just make sure that it adds up to what it's supposed to be. We have tools and systems in place that tell us what the cost should be, and we just need to make sure it's within those ranges. Also, we're looking to make sure that they are appropriate. The length of stay was appropriate, or did something happen? So we're looking if there's accident codes, just making sure everything is in line with what should have happened.
Can you give me an example where you looked at a claim, you looked at the code, you added it up, and you just said, hey, this is just not correct? Can you share a real world example?
Absolutely. There was 2 bills that came in. They were both high dollar. Decoded it. They looked kind of like, okay, this maybe could have happened. However, working in the OR, kind of looking what was going on, you knew that absolutely could not happen. So, we did our I did my normal review, kind of decoded everything and said, hey, this shouldn't have happened. So when you go in for a big medical procedure, this was an open heart procedure. Sometimes you're admitted the day or two before to get all the pre-op lab work done. But once you're on the floor, you actually get discharged to go to the OR. And then once that procedure's done, you get readmitted to the ICU. So if it goes to the billing department, sometimes that looks like two separate claims because it was two separate admissions.
Right.
And then there's pricing attached to each one of those.
Yeah.
So since it looked like two separate admissions, they attached the price to each one of those. Each one of those were $400,000 priced, and it was actually one long stay. So my job here at Roundstone is to make sure everything is cohesive. You don't have an open heart surgery and go home in 2 days, or just receive post-op care on a medical surgical floor. So using my clinical experience and knowledge, I was able to recognize that something wasn't right. And, I reached out to the TPA for additional information. It's called an itemized bill to make sure everything is correct and what happened did happen. And we are paying the correct pricing for it.
So 400,000 is obviously large claim. How much were we able to get corrected and save? Was it a full 400,000?
We saved the full 400,000, and actually just a little bit more because some of the rehab was included in the price. So we were able to save just a little over 400,000. But that was just using my knowledge of what the procedure was, where it was, and saying that something's just not right.
So Lisa, as we were talking, it looks like a procedure was billed twice.
Mm-hmm.
You found a $400,000 mistake.
Mm-hmm.
I guess if claims aren't reviewed, that just gets paid by another stop loss insurer. Is that fair?
Absolutely. That's fair to say. Just, while billers, TPAs, they might have medical terminology training or some medical training, they don't have that clinical experience to say that just can't happen. So that's why it's so important that we have nurses reviewing those high dollar claims here. Whether it's our TPA or other TPAs, we review all of the high dollar amounts just to make sure that it is billed correctly and it does add up. You get that little nursing sixth sense saying something's not right.
So when we say at Roundstone, hey, we actually look at claims, that's exactly what we're talking about. This is a perfect example.
Absolutely.
It's worthwhile to look at claims, and just paying them without reviewing them, that wastes a lot of money.
It wastes a lot of money. Absolutely. We look at decode every code that's on there to make sure for accuracy.
Great. Is there anything you see that kind of repeatedly happens that seems like over and over again this mistake is made?
A lot of it is, luckily, I have experience in the OR. So when people go from the floor to the OR back to another floor, charges get unbundled when they should really be bundled. So what that means is you have a global billing for one surgical procedure, and everything pre-op, the surgery, and post-op should all be included in that bill. Mm-hmm. However, sometimes the drugs get unbundled or certain devices get unbundled, and you pay for the surgery, then plus you're paying for separate line items. So a lot of that happens, and you see it over and over again. And that's our job to catch that and correct that. Mm-hmm. And one of the neat things I always kind of laugh at, the hospital does the billing. There obviously is markup for profits. The network will reprice that claim. Mm-hmm. So it's kind of like going into a big box store and the sale where you have 40, 50, 60% off. However, if you really look at that price tag, sometimes it's just to get you to buy it thinking it's on sale. Mm-hmm. Kind of the same thing happens in the insurance industry. You might get a huge markdown from the network, but realistically, it's just bringing down to the price that it should be. So it's our job to look at those charges to say, well, if you're paying only 40% of an unbundled charge, you're actually paying 40% that you shouldn't be paying. Right. So that's how nursing really affects those high dollar claims. You take $1 million claims and bring them down.
That's why folks that focus on discounts alone are really falling into a trap. That fixation on network discount as a metric mm-hmm. that should, guide your decision. That's really not the way to go.
Absolutely not.
Yeah. So what about certain types of specialties? Are there certain types of care that you tend to see more billing errors than others?
Once again, it's when they're discharged from one floor to another. So anytime there's procedural intervention at all, that's when most of the billing errors happen. You have one big billing department, but there's somebody billing for each specialty within that. So they try to scrub it and make it all fine, but that's when a lot of the billing errors happen.
So we had mentioned Operation Rainbow. What has that experience taught you about the U.S. system and what the bills you see today, and kind of what influence has that had on you with just your perspective on healthcare in the United States?
Well, we are definitely a very wasteful nation. Everything is single use here in the U.S. Now, when I started back in the OR, we did reuse a lot more and re-sterilize stuff. But nowadays, it's like, oh, here, you want this. And everything is click button, so whenever you're doing charting in the OR, you're just literally clicking. And if you get distracted, not to say that we want to, but you click the wrong thing, you just charged somebody for something that they didn't use. So going on these mission trips, it makes you realize, we only can use what we bring. So you better double check and triple check before you open something, measure twice, cut once. Same thing. When you come back after a mission trip, it's great to be back in the U.S., but you really double check before you open something because it really matters and the patients are going to end up with charges.
Who's doing the clicking? Is that the nurse's responsibility, or is it a joint with the doctor? How does that work?
It's a joint with the doctor. When the doctor books the case, they use certain CPT codes and procedural codes that bring up what should be used. And then it's the nurse's responsibility to go through that list of the commonly used items and either add something that we use that's not on the list or take away. So if you don't take away, that means that person is getting charged for that. And that's how the unbundling charges happen.
Do you ever find, I know we had a claim, this was years ago, where it was a stroke and they had put a stent in and basically charged for, I think, 3 or 4 stints. And it probably fell in line with what you just described, where it was a mistake. Is that something that the nurse review picks up on? Or
I definitely am keyed in on that just because of the OR experience.
Right.
But absolutely. So in the OR, when you're charting that, let's say they asked for it, it wasn't the right size stent. Not to say they weren't intending on using it, but it should go under a wasted item. And then that's just something that the hospital would eat the cost of. Whereas if it is marked as implanted, then the patient's going to get the cost of that.
All right. So have you ever saw a claim that just jumped off the page at you and said, this should not even have happened to begin with?
Yes.
Like an unnecessary surgery, or not, not really medical necessity so much, but just it didn't align with the outcome that patient was really looking for.
Correct. There is actually one. The member went in for a cardiac related and ended up having their ankle fixed. So quite different. And then just kind of decoding down in the little far corner, there was a W code, which is an accident code. So that, reach out the TPA. We need the accident report to see who actually, was it another event that happened at the hospital? Did the patient trip and fall? Like what happened and who is responsible for paying the bill on that?
With what you do, reviewing claims, do you have member interaction?
No.
Are you able to ever impact the member through a recommendation or questions or anything like that?
Absolutely. I'm part of the partner solutions team, and that's our cost containment. So whenever we're reviewing high dollar claims, or if they just started a high dollar medication, we definitely reach out to our members that are vendor partners that we can have cost containment and recommendations for the groups.
You have an example where maybe you had been looking at the claims and were able to say, hey, there's an opportunity here for to change the approach for this particular member? Or?
Absolutely. A lot of it was with medications. It's depending on where that medication is sourced. Some of the autoimmune diseases, those medications are up to $26,000 a month. And if you source them internationally, sometimes it brings it down to $9,000, which is still extremely high cost, but it's the same medication. It's just sourced somewhere else, and we can have a lot of cost savings. So we work closely within the partner solution team to come up what's best for the member and the groups.
So it's not just looking at claims kind of after the fact on a billing point of view. You're also contributing to proactively maybe pricing and cost being a little more
Absolutely.
attractive.
Absolutely. And that's why it's great with, we use our own TPA by water. We have inside information on the members and we can kind of see their progression. We're able to refer them to case management and intervene when we can, because we have the whole picture of what's going on
You
with
get
the
to
member.
see a little earlier than
Absolutely.
when you're acting just as the stop loss insurer.
Correct.
It's kind of the horse is out of the barn, if you say, right? Yeah.
Yeah, a lot of times whenever we're reviewing them as a stop loss, we are retroactively reviewing the claims, but whenever we have by water, we get notifications, we review them, we know when they've hit 50% of their spec, we're able to see what's going on and see how we can intervene on cost containment.
That's great. So Lisa, we were talking a little bit about your interaction with members and helping them out in terms of, buying prescriptions. How do you manage the privacy issues along with trying to help this employer navigate some of their large claims? How do you balance those things?
A lot of it can be done without using members' names or telling them what's truly going on. So that's what it's very nice. We can say that, we know that you have a member on this high dollar medication. This is how we can help you out. So there's not a whole lot of HIPAA involvement or giving away what's going on with their members. It's still very sacred. The members' medical issues are theirs and not the company's, but we can help by just, being transparent in what we have to offer and knowing what we can give. And once again, the more insight we have on the member, depending on the TPA and looking at claims and, clinical case management information, is better that we can help that group out.
So when you know about a member that's having a rough go of it,
Mm-hmm.
they're on a journey in their care that is going to be tough. Are you ever able to offer a few insights into say, hey, beware this of going in this path or that? Not necessarily providing care to them, but just saying, this is a circumstance where you need to be aware of.
Absolutely. And once again, it goes back to knowing what information we have. So the more information we are provided, we can guide. We have communication managers that, discuss with the groups. We can provide information and say the care can go, this way or that way. And these are the solutions that we have, whether it's a infusion medication or just a high dollar drug, or they're going to be receiving a lot of ongoing treatment. We are able to help that group out navigate which way they need to go. With how the member's care is going without giving exactly what's going on.
Have you ever been able to say, hey, you don't want to go this path? Or is that going a little too far?
Everybody has a choice. So we don't really say, no, it's not good to go this way. We just present options and the best recommendations that we can go.
Great. Well, Lisa, I've enjoyed talking with you. Obviously, you've had a pretty varied career path as a nurse. So at Roundstone and what you do today with the partner solutions and in reviewing high dollar claims, what is it about Roundstone that you like?
It's every day while you're kind of doing the same thing, it's still different. You're kind of a detective. You get to use the clinical side of your brain that you would never get to if you're just working in, just the OR. You get to, look at cancer treatments, look at operations. You get to explore. That's really, as a nurse, it's really exciting to keep that clinical knowledge up and continue to do research on new things we might see, whether it's gene therapy, cell therapy, to see what's going on with that. But, just like bedside nursing or OR nursing, it's still a thank you. It's a thank you for doing what you do, whether it's a thank you for an underwriter or one of the communication managers to explain what's going on medically in a way that they understand. It still comes down to, we're doing a good job. We're helping healthcare costs hopefully remain lower and providing medium, small businesses with the ability to provide good healthcare coverage for their members.
So you're still learning.
Still learning every day, never stops.
That's great. And you're still helping people.
Absolutely.
If you would talk to an employer or one of their employees, what would you say to them in terms of, hey, Roundstone's different, and here's why you're in a good place with being a Roundstone customer?
First of all, we care. We have 3 nurses on staff, and when we truly look at claims, we care about that member that's going on and trying to find the best solution that they can still be in that circumstance, get the treatment that they need, and not have to, pay way out of pocket for the services that they need to be successful.
So it's not just about the money.
It's absolutely not. Not. I got chills right now. It's not about the money. It's knowing that we made an impact financially, which affects people emotionally, and emotions affect people physically. So we may not be, hands-on bedside care giving a pill to the member, but we are saying, hey, you need this treatment. Let me help you provide it the best way possible, that you can afford it, that your company can help you afford it. So it touches your heart still to know that we make a difference.
A lot of times the employers, the HR people think that some of these cost savings occur or happen at the expense of the employee or their family member. What I'm hearing from you is it's actually the exact opposite.
It is. There's great opportunities in preventative medicine, as well as it's not extra cost to them. It's amazing to see. And there might be a little extra work here and there just to, get that up and going. But once it's going, it's phenomenal savings, not only for the group, but at the member level as well.
Yeah. With your track record, career, and your current, you couldn't be doing this if it was harming the family member. That's not something you would.
No, we're not here to deny any treatments.
Yeah.
We are here to support what the doctor feels medically necessary.
Right. That's great. That's wonderful. Thank you.
Thank you.
You mentioned case management.
Mm-hmm.
How do you work with case management notes, and are you able to help when you start digging into those?
With case management, we do referrals for our Bywater members, and then we can keep up. They get the medical records of the member. We can see, within a month or so, what's really going on and what's the cost going to be, or how we can intervene as cost containment to get them on the right path, so the group is not stuck with high dollar claims.
So brokers, advisors, employers, everyone every now and then will bump into a claims report. What's a common mistake that they make when they look at these reports?
I think a common mistake is a code is not just a code. It just tells you one little bit about what's going on. For example, somebody could have breast cancer. It's just a code for breast cancer, and it doesn't give you the whole story. It could be stage 0 all the way to metastasized already. So having all that information, that's why it's so important when you pick a TPA, whatever information they give us, that's what we're going off of. So whenever they're looking at a claim, it might have a very scary diagnosis on it, which breast cancer is scary no matter what, but there might be a little bit more. So when we are able to refer to case management, when we have the detailed information, or can even look at how their claims are coming in, we have a much better handle on what's going on in the real situation.
So if you could spend 5 minutes with the employer on claims, what would you tell them?
I guess kind of just what I said, a diagnostic code is just that diagnostic code. Mm-hmm. You can have extremes at both ends. Somebody can, there's a lot of people walking around in congestive heart failure. Some people are really symptomatic to it, and other people, they just take a medicine and move on with life. So having that insight on what's really going on with that member is very important, and that comes from picking the right TPA. As the reinsurer, we review claims. Some TPAs give more information. Some are very limited information. The more information we have, the more successful the renewals will be.
So information is key.
Information is absolutely key.
And I guess that's the good part about self-funding.
Mm-hmm.
Yeah. I get this question asked to me a lot. Folks say, if you could change one thing in healthcare, in the healthcare system, what would it be?
For me, I would still probably go back to medications. We pay a high dollar cost for medications in the U.S. Through our partner solution teams, we have a lot of solutions to make those costs lower, same medication, get the same treatment. But most of all, I would say be proactive in your health.
Right.
Go ahead, sir.
Care about it, right?
Care about it.
Yeah. Yeah. That's sort of like what you said before, how we were wasteful in our the care, the environment, and all that kind of stuff. So, we've brought up your work and the mission trips. I imagine we keep you a little busy here at Roundstone. So in your free time, why are you doing that?
It's just the enjoyment. I was in the OR for 30 years. It's nice to give back. The purpose of life is, living well and giving back to society. It's nice to stay in that clinical setting still, get that experience, and just remember why it's nice to, sit at a desk sometimes and go home one time.
Right.
But I do the mission trips because those are families that would never be able to afford what we're doing. We do a lot of club feet. While kids can grow up with deformed feet and still walk, they get to have a normal life
Right.
because they can't afford it. Medicine down in third world countries is completely different.
What are some of those countries that you go to?
I've been to Guatemala, Nicaragua, and Honduras.
Great. And then how long were you in the military?
I was in for a little over 7 years.
7 years. And you worked in OR?
I did the whole time.
Yeah, that's interesting. Lisa, so in the OR, is there experience there that you're able to bring to your work here at Roundstone?
Absolutely. I would say detail oriented. In the OR, if you miss something, it could mean somebody's dying on you. Here, when we're looking at claims, if you just miss one simple code, that could mean a whole lot too, or a simple date. So the detail oriented you bring over from the OR, it's salespeople and underwriters might think they're dying, but nobody's actually dying.
Right.
But it is that keen sense of detail.
So in the OR, I'm guessing, because I don't think I've actually ever been in one.
That's good.
But it can be hectic.
Mm-hmm.
It's all hands on deck. Is there any comparison to what you do? Like, we're going into our busy season now, where we're going to be renewing and looking at a lot of claims. Is there any comparison?
It's almost completely comparable. In the OR, you have the surgeon, the anesthesiologist, the nurse, the scrib tech, and then turnover crews. It's kind of the same thing here at Roundstone. You have the underwriter, you have the communications manager, nursing, cost containment, the junior underwriters, and communication is key. In the OR, if you don't communicate, things happen. Same thing at Roundstone. If you don't communicate, things happen. Everybody has their essential role and they're doing something, but takes everybody together to make it work. So
Right.
There's a lot of comparisons.
And with your mission trips, is there anything that you've learned there that you've been able to bring back to the job here at Roundstone?
First world problems is what we say. It's very humbling going on the trips. You are able to take somebody that wouldn't be able to do it for themselves and be able to give them that service. And that's kind of, I don't feel like it's too much of a stretch. It's the same thing. We're able to support small and medium-sized companies to provide quality health care and put those cost containment solutions in there so they can have something that they might not be able to have. So, while one is, helping somebody walk, this is also giving somebody medications that they can afford. Maybe it's to lose the weight, treat the diabetes, but, the out of cost expense, if they're getting it through the US, they probably wouldn't be able to afford it, but we have those cost containment solutions in place that they can get from, sourcing, and they're able to afford the treatment that they need.
I was on the phone call recently with a prospect. And the woman speaking was in HR, and she said that they didn't really need to hear anything about our solution because they had spent a lot of time on our website and a lot of time researching us. And she started off by saying, "I think you're the only insurance company I've seen where people actually like you." Would you agree with that?
Absolutely. This is a whole different side of medicine for me.
Yeah.
And it was just really neat to see, like, hey, when I'm looking at a claim and I know my fellow nurses are looking at a claim, we're like, what can we do to make this experience better for them? So while we don't have that personal contact with them, through our team, our communication manager, they can communicate to the group and say, hey, we have these solutions, nursing discovers what needs to be done. And then we have all those teammates in place to say, hey, this is how we can provide the best care.
So your job here is at least aligned with your mission.
Oh,
work.
absolutely.
Yeah, great. I'm glad.
Absolutely.
Well, Lisa, we're really thrilled to have you at Roundstone for a whole bunch of reasons. And I'm really glad you took the time to come in here and chat and
Well, thank you.
share some of the good work you're doing on the claims. We really appreciate it.
Very, very happy to be here. Thank you.
Thank you.